This is the Emergency Medical Minute, sponsored by Health One.
So this is a really interesting study incorporating both our most trippy drug, ketamine, and our psych patients, the patients who we really can do better by. This was an article from the journal Depression and Anxiety just this year. And so suicide, surprisingly, is actually listed as the 10th leading cause of death in the United States. You'd think you could come up with cancer, heart disease, motor vehicle accidents, but suicide makes it in the top 10, and we just really don't have any great treatment. We keep them here for up to 72 hours in the ED. They get a psych eval, maybe they get inpatient hospitalization, but there's actually no solid scientific evidence that doing inpatient psych hospitalization actually decreases their rate of completing a suicide attempt later. So there have been a lot of small anecdotal studies that have said that ketamine profoundly improves depression and can prevent these suicidal feelings. It was originally noted in patients that got sedation for other reason. They come with a shoulder dislocation, get ketamine, and then they're like, whoa, I felt so good all week and I wasn't depressed. So this group wanted to do an actual randomized study of acutely suicidal patients in the ED and give them a single dose of ketamine and see if that improved their outcomes. So this was a small study. It's what you call a proof of concept study, meaning we can't really take it as evidence, but they were just seeing, is this a feasible thing? Does it work? Does it have any harmful effects? Can we move forward and kind of study this a little bit more? So it's done at the University of Alabama. They recruited 18 acutely suicidal patients. These patients had already been screened and deemed in need of hospitalization. So they were pretty profoundly depressed and suicidal. They couldn't have a complicating condition like they were drunk or they were high on meth or they had another underlying psychosis, like they couldn't be schizophrenic plus depressed and suicidal. And so they randomized them. Half of them got just a saline bolus, essentially, and the other half got a low-dose ketamine bolus, 0.2 milligrams per kilogram. So really on the low end. If we were doing pain dosing, that would be on our lower end of pain dosing. They got a single bolus, and then they went back in sometime later. Let me see how much later. Anyway, 90 minutes later. And out of the placebo group, there were 33% that said, yeah, I feel a little better. Maybe I'm not so suicidal. But out of the ketamine group, 88% of them said, I no longer feel suicidal, and I'm not nearly as depressed as I was when I came in 3 hours ago. And they measured those effects, and it looked like it lingered out for at least 3 days, that they were still feeling that their mood was improved. So again, this isn't, evidence that we should start giving ketamine to all of our psych patients, but it is like a really interesting thought for future studies and, potentially something, especially if we have a depressed patient that's in pain, our drug of choice should probably be ketamine because it's going to have the side effect of improving their mood as well. So that's it. Thanks.
Hello, I'm Dr. Stephen Bradley, anesthesiologist and U.S. Naval officer. I'm also the host and creator of the Black Doctors podcast. This podcast provides weekly 30-minute episodes that tell the stories of minority healthcare professionals. It is my hope that hearing these unique and inspiring stories will encourage others to consider pursuing these challenging and rewarding career paths. So please join me for the Black Doctors podcast. Available on Apple Podcast, Spotify, and all major streaming platforms.